Mr. Dmitriev, of course, the problem is the supply. There's a shortage of, I think, all types of vaccines at this point. What's the capacity of Gamaleya to produce vaccines? And is it how many countries is the Sputnik V going to be initially rolled out? Would you have any?
Yeah, so we believe that this year we can supply vaccine to 700 million people around the world. So we are not capable as of now to provide it to billions of people. And we have facilities inside of Russia. We have also facilities in China, Brazil, Korea, India, and several other countries that are manufacturing for us. So as you see, this year will be a year of vaccine shortage in all of the countries. You know, Europe said that only by September they will vaccinate many people. So this is why we'll be one of the providers, and we are happy to start supplying to Philippines as soon as we get an approval here. But of course, we will have to supply over, 6-7 months any volumes that Philippines need. So over 6-7 months, we can supply any volumes that Philippines need from us, but basically it's going to be gradual supply over the next couple of months.
Yeah, Mr. Dmitriev, the headline here, of course, is that Russia is ready. You brought up the point about the Philippines. Is the Philippines ready? Where exactly does the Sputnik V stand when it comes to herding the bureaucratic and other protocols involved in actually getting that vaccine here?
Sure. Well, we submitted the documents already to your health ministry. And by the way, you have a very professional team. And as I mentioned, I think they're doing a very professional job with other vaccines, with Sputnik, to evaluate everything. So all we can say is that Sputnik has already been approved by 22 nations. And by the end of the week, we expect approval in 25 nations. And in Russia already, millions of people have been vaccinated, in Argentina and other places. So we hope that approval in Philippines comes. We have submitted all of the necessary documents for this. And, we are ready to start supplying whenever this approval comes in Philippines. But once again, we have no doubt in the professionalism of your regulator, and they're doing an excellent job with us and with other vaccines as well.
Well, we understand that some documents are still missing from your application for emergency use authorization. Is that correct? Well, what's holding up the approval? Would you know?
So we don't believe any documents are missing, because based on the documents we've given, 22 other nations already approved, including today Pakistan approved, and we have 22 nations that have approved, and the same set of documents was sent to Philippines. So we don't believe that anything is missing. Philippines has exactly the same documents as all of the other countries have.
Okay, can you expound more on the gradual rollout of the Sputnik V vaccines here in the Philippines? So when you say 6 months, what would be the earliest possible delivery time? And because that's basically going to be the baseline for the 6-month rollout that you're talking about, and how many millions are we talking about if indeed it comes to 1 million?
Sure. Well, I don't want to go into too hypothetical because we don't have approval yet. But I will say that upon the approval, within the next 2 weeks, we will be able to supply, some doses of the vaccine, so you can start vaccinations. And that, again, needs to be approved by your government, how much. And then we will basically be able to supply, next month, maybe about 10% of your total need in vaccine from us. And then the following months, about 20% of your total need. And then the following months, 30% of your total need, so altogether around 50% of your total need in the next 3 months, and then the rest over the other 3 months. So we have, it's very important for us to know, though, when Philippines registers, because right now, of course, we have huge demand from 22 nations that already are using our vaccine. And just this week, already 12 nations are using Sputnik. For 10 of those nations, it's the first vaccine they receive. So, of course, in order to plan, we need to understand when the approval comes, but we will work very closely with your government to make sure that Philippines is a great priority, of course.